My name is Jihed Sehli. I am a psychiatrist and psychotherapist. I have been working in Freiburg, Switzerland for about 8 years. I have held various positions as a psychiatrist within the Freiburg Mental Health Network in Freiburg. And now I am setting up a private practice in the city of Freiburg. For about 4 years now, I have started to take an interest in this field, the use of neuromodulation techniques, brain stimulation to treat mental disorders. And then, during my training and out of curiosity to explore the different neurostimulation techniques, I discovered tDCS. I started hearing about it around 3 years ago, and then it's true that it was interesting to try it out to see a little bit what this technique could offer. It's a technique that, in my opinion, has a lot of advantages like ease of use, the potential accessibility of the devices with a good cost to benefit ratio, and also considering their size. It's not a sophisticated technology that you would need to set up or organize in a complicated way. And also with this potential for home use, meaning that the patient could use these devices at home under the supervision of the psychiatrist. It's been about 2 years since I started integrating tDCS into my practice, and I've tried a few devices to see which one would really suit my practice. And it's true that I found the Flow tDCS devices also had the advantage of being very practical and easy to use. It's also a thoughtful design that truly makes sense, that effectively speaks to people, that's highly practical, and that you could quite easily show the patient precisely how to use the device and then carefully supervise them in a treatment done at home. Break time equals 0.5s/. That's why I turned to using the Flow tDCS devices. This is a truly non-invasive stimulation technique. So what I explain to the patient is that we use a low intensity of electric current. I always use the analogy of the equivalent of the electricity or amperage of batteries, small batteries. And then we apply 2 electrodes, so an anode and a cathode, on 2 brain regions. Recent research on depression has shown that there is often an imbalance between hyperactivity in the right dorsolateral prefrontal cortex and hypoactivity on the left side. So, the principle of tDCS is to restore a balance between these 2 brain regions. So, electrical stimulation with an anode on the left side will increase the excitability and stimulation of the hypoactive region. And on the right side with the cathode, it will inhibit the hyperactive part of the dorsolateral prefrontal cortex. And then this helps to bring about this balance and to repolarize brain function in a balanced way. There's also the potential in terms of side effects and tolerance. So it's a treatment that is very, very well tolerated. Personally, in my experience, I have not encountered any significant side effects. And that's also what I explain to patients, because among the concerns that patients have, and it's understandable for any psychiatric treatment, is the question of tolerance. It's true that, for example, medication treatments, antidepressants, unfortunately have a lot of side effects, and we have to deal with that. Now, I offer patients an alternative that is much better tolerated. And at most, what I have personally seen or noticed as mild side effects are small red spots at the sites, which disappear quickly, or mild headaches that also go away on their own. Sometimes I also suggest to patients, if it bothers them, to take a first-line painkiller like paracetamol. The outcome is often positive. So another advantage is also this short duration of use compared to other pharmacological interventions. So generally, we go with a treatment every day, meaning 30-minute stimulation sessions, 5 days a week for an average of 7 weeks. And often that's enough. Sometimes maintenance sessions are needed later on, but personally, I haven't had to do any maintenance sessions. It was always an acute treatment over those 6 weeks, and then, well, that's all good. If we compare these durations with, for example, an antidepressant treatment, according to the guidelines, a patient should take an antidepressant every day. And then you count at least 6 months after the remission of depressive symptoms. So that often means a treatment duration on average of 6 months, 9 months, or even a year of antidepressant treatment. So you really see the difference compared to this treatment duration. So the ease of use, as I mentioned, is because the sessions are done at home and the patient can do other activities, read, watch TV, listen to music, or do any other activity. One advantage I really want to highlight, and I want to congratulate Flo for including it in the treatment, is having integrated behavioral therapy, a digital intervention, at the same time as the neuromodulation treatment. And that's really a very, very interesting advantage compared to other tDCS technologies that I've been able to use. In fact, I've noticed, and this is also supported by research, that there's a synergy effect between the stimulation, meaning the electrical stimulation, and behavioral intervention treatments. Combining the two can greatly increase the chances of remission compared to using either one of these interventions alone. So, with Flow tDCS, the use of the mobile app, which guides the patient, provides psychoeducational information, and then offers exercises or behavioral interventions to fight depression, is extremely valuable when combined with the electrical treatment itself. Personally, I've taken training in digital health. It's a field that interests me a lot. And then it immediately caught my attention that there was a digital health type intervention paired with this treatment through an app. So that's another advantage of this app. We have the ability to monitor the treatment remotely and to track on our computer as therapists, with the patient's consent, whether they've done the sessions, the exercises, and also the completion of scales measuring the severity of depression, like the MADRS scale. And that way, we also have a graphical representation of how depressive symptoms are evolving. Personally, I share this representation with patients when they come in, and I show them the curve visually. So, where were you before? And now we can see the decline, the improvement in depressive symptoms. And that's also the visual aspect of making the improvement tangible. I think that's really helpful for patients to see it in a concrete way. So, I worked with a patient, a young man of 24, who went to university and had a lot of difficulties with his studies. He's also been dealing with chronic depression that's been going on for 2 years. With the impact on his studies, he couldn't succeed or make progress, and at the same time, not being able to succeed in his studies made his depression worse, so he was stuck in this vicious cycle. So with him, I tried 2 antidepressants along with psychotherapy. There wasn't any sufficient or significant improvement. We also had to try an augmentation strategy with an antipsychotic treatment. And even then, things still didn't move forward. So the clinical situation, and that's when I suggested to him that we try neuromodulation with flow tDCS. That immediately caught his attention. He was curious and motivated. He was also able to read up on it himself and get information, and he was open to this treatment. So we started the stimulations using the standard protocol over 6 weeks. Then we already saw that after just 2 weeks, there was a significant improvement, more than 50% improvement on the MADRS scale. After 6 weeks, we observed about an 80% improvement on the MADRS scale and also clinically in the patient's experience. So he was really in remission. We didn't need to do any maintenance treatment afterwards, and the progress was positive. He was able to pass his exams, finish his university studies, and then start a stable job. And then I was able to see him recently, still in remission, and he was really happy about how things had turned out. So things were going well, and he was optimistic about his future career prospects. Among the clinical cases that stood out to me, there was also a patient in her 50s who had been struggling with chronic depression for more than a year and a half, with a lot of cognitive symptoms, memory problems, trouble concentrating, which had a significant impact on her professional life. So her main complaint was also these cognitive difficulties. And then when she came to see me, I think it was this cognitive aspect that made me consider suggesting flow tDCS to her, based on the idea that cognitive improvement is one of the targets highlighted in the research. And then we started a treatment without antidepressants, so it was monotherapy with tDCS. Currently, she is in her 5th week of treatment, and we have observed an improvement of about 65% on the MADRS depression scale, as well as in her clinical experience. Her cognitive difficulties have also improved, so things are much better now. We still have work to do, so it's still ongoing, but it's true that it was striking to see this progress after 5 weeks. I had a patient we were following for depression, which improved with antidepressants. And then later on, there was a pregnancy, so for safety reasons and since things were going well, we decided together with the patient to pause the treatment and see her regularly and support her if needed. And then it's true that with her, we planned ahead and said that if there were any difficulties with her mood or a depressive relapse in the postpartum period, we were ready to do tDCS. It would be a good indication to use it during the postpartum. So the patient, she's on board, she's well informed, and I think it could be a good option if we ever encounter depressive symptoms in the postpartum period. And that still allows us to offer some security to this patient, to reassure her, to know that there's an option available in case things don't go so well. Because it's true that it was a concern to say, do I have to go back on antidepressants while I'm breastfeeding, for example? So in my daily practice, I suggest and consider flow tDCS for different patient profiles or different clinical situations. So there are clinical situations where it's a first-line treatment for people who don't want to take medication. We completely understand, the concerns about side effects. And so right from the start, as a first option, we go with flow tDCS neuromodulation. Often these are young patients without comorbidities. And also, I think their profile makes it so that this interests them. It's a technology that speaks to them as well. Another patient profile is those with a lot of comorbidities who are already taking medication for other health problems, physical ones, for example, as well. And then to avoid adding even more drug interactions, we opt for tDCS. So another patient profile is when cognitive disorders are the main issue. I've seen that it could be very interesting to offer tDCS as a first-line treatment in those cases. Depression associated with anxiety as well. And we also see in some research that the target can also be depression with comorbid anxiety, so offering tDCS. And then there's another category of patients, those with treatment-resistant depression, where we've tried quite a few therapeutic options, often medications, and we haven't been able to get results. And in those cases, I suggest tDCS as an adjunct treatment to what is already in place. And then we see, well, I see that it can have a positive impact. This also comes up in research and in the recommendations. So there are more and more papers recommending tDCS as an adjunct treatment for treatment-resistant depression. My own limited experience with tDCS over the past year has also really motivated me to talk to my colleagues about it and to recommend that my colleagues use this treatment in the management of depression. It's true that currently, when we talk to colleagues about it, often they're actually quite open to this treatment. There is enough evidence from research regarding its effectiveness and also its safety of use. So, personally, I don't hesitate to recommend it to colleagues as a therapeutic option for depression, whether as a first-line treatment or even afterwards. When you look at the profile, effectiveness, tolerance, cost, accessibility, it's true that intuitively and quite obviously, you can see that this is a promising treatment that could really have a place as a first-line option as well as an adjunctive option in depression. To my knowledge, in some countries around the world, it's already in place and recognized as a first-line treatment. And it's something that personally I see a great deal of sense in, very few side effects, remarkable ease of use, a relatively short duration of the entire treatment process. And then, so the overall cost is quite comparable or even is notably low compared to other much more expensive and often less effective options. So often in my clinical practice with patients, we do an in-person session first to get acquainted, ask questions, understand a bit how it works, and see the device. After that, we can, in the same session or the next one, also in person, start the treatment, so during the session. So often the first session is done together with the patient in the consultation, and then we see with them if they feel comfortable continuing at home. That's always the case since it's simple and easy to explain. Sometimes it happens that when they come in for follow-up appointments, they bring the device with them as well, and then we take advantage of it. We do the session in person, all while working on something else, talking, discussing, or doing psychotherapy. What I often recommend to patients is to combine the treatment with the behavioral interventions that are in the app to maximize the chances of a positive therapeutic effect. So I recommend that they follow the different modules, engage in physical activity regularly, review their nutrition, and of course be consistent, meaning to use the treatment regularly and not skip sessions. So and that's something we can review with them later on. Actually, after just 2 weeks, we start to see beneficial effects. After 2 weeks of treatment, patients feel a difference and are able to describe it. We also see it in the weekly assessments through psychometric testing. After that, the effect becomes much clearer and more pronounced by the fourth week. So at that point, we can clearly see often the response is already there. The improvement is already significant. So treatment with flow tDCS can be done as monotherapy and used alone, so administered on its own. But it can also be combined with other treatments, other therapies. So both options are possible. Already, the flow treatment itself, the package includes behavioral interventions in the app, which are themselves a form of treatment. So it already contains a behavioral psychotherapeutic component. I think that can be sufficient as a therapeutic option. Then, in situations where there is resistance, or we see that there isn't a satisfactory response, it can be combined with other interventions or medication.